Hi all, welcome back to the second lecture of the ECG lecture series. Today we are going to learn conduction system of the heart and how to record a 12-lead ECG. I am Dr. S. Prakash Babu, Associate Professor of Emergency Medicine, Karpagi Vinayaka Institute of Medical Sciences and Research Center, Changalpattu. So what is the conduction system of the heart? It's a specialized and modified cardiac tissue which is useful for generation and conduction of cardiac impulses. As you know already, heart can generate its own impulses and it can propagate. In the last lecture, we have discussed in detail about that. And conduction is very rapid through the system. Cardiac conduction system is useful for generation and conduction of the impulses. So how it is formed? It's formed by specialized muscle cells. It functions as an initiator and also a propagator for the impulses. It contains a pacemaker, a gateway, and various tracts. Let us learn about the pacemaker, the gateway, and the tracts in the cardiac conduction system. So this is a picture to depict the organization of the cardiac conduction system. As I told, there is an initiator, that is the sinoatrial node, which is a self-generative. It can generate its own impulses irrespective of the neural connections. And then I told you about a gateway. The gateway is the atrioventricular node. We'll learn why it is called a gateway a little later. From the atrioventricular node arises the tracts. One tract that arises from the atrioventricular node is the bundle of His. The bundle of His soon divides into one right bundle branch and one left bundle branch. The right bundle branch descends down the septum and then ascends up the right side of the heart, the right ventricle. The left bundle branch again divides into a left anterior division and a left posterior division. The anterior division supplies the anterior part of the left ventricle. The posterior down division descends down the septum and then ascends on the left ventricular free wall to supply the free wall and the posterior aspect of the left ventricle. And finally, the tracts are divided into multiple Purkinje fibers. The Purkinje fibers directly innervate the cardiac muscles, propagating the action potential from conduction system into the contractile system of the heart. Coming to the SA node, it is located at the junction of superior vena cava with the right atrium. It is the main pacemaker or generator of the cardiac conduction system. It is densely innervated with both postganglionic adrenergic nerves and the cholinergic nerve terminals. It contains more than threefold greater density of beta adrenergic receptors and muscarinic cholinergic receptors than the other parts of the cardiac conduction system. Internodal and intra-atrial conduction. As soon as SA node is depolarized, the impulse is directly spread into the atria, leading to atrial depolarization. There are three internodal tracts which connect the two nodes, that is the generator and the gateway. The internodal tracts are labeled as anterior, middle, and posterior. There are names given to the internodal tracts: anterior internodal tract of Thorel, middle internodal tract of Bachmann, and posterior internodal tract of Wenckebach. Connect the SA node and the AV node. The impulse travels along the internodal tracts to reach the AV node. As I told, AV node is also called the gateway in the cardiac conduction system. It is located just beneath the right atrial endocardium, anterior to the ostium of the coronary sinus. As I have been telling, it is the gateway because whatever impulses reaches the atrioventricular node, it is delayed for some time and then it relays the impulse, thus functioning as a gateway to effect ventricular systole after atrial systole. You know that during systole, the blood is ejected from the cardiac chamber. During diastole, the chamber is relaxed and is ready to receive the blood. So if heart has to effectively function as a proper pump, The atria have to contract first and then the ventricles have to contract. As you can note, whenever the SA node is depolarized, the impulse directly spreads into the atria almost instantaneously, and the only connection between the SA node and the ventricles is the AV node, which has the property of delay. Normal AV nodal delay is 0.12 to 0.2 seconds. Then we learned about bundle of His and the bundle branches. Bundle of His starts from the AV node and enters the ventricular septum. Atria and the ventricles are divided by a fibrous band of tissue which is non-conductive to the electric impulses. The only normal conduction between atria and the ventricles is the bundle of His, also called as supraventricular conduction system. It branches into left bundle branch and right bundle branch. I have shown you in the pictures. Left bundle branch again divides into the left anterior fasciculus and left posterior fasciculus. If we consider right bundle branch also as a fascicle, there are three fascicles in the heart. Terminal Purkinje fibers, which connect with the ends of the bundle branches to form intertwining networks on the endocardial surface of both the ventricles. They transmit cardiac impulse almost instantaneously to the entire right and the left ventricular endocardium. So coming to recording a 12-lead ECG, how are you going to record 12-lead ECG and what are the technical aspects that you need to learn during recording an ECG will be discussed in next few minutes. First of all, patient positioning. Keep the patient in supine position so that you can connect the electrodes. Ask the patient to not to move until the procedure is completed. If the patient is moving during the procedure, there can be electrical disturbances and your ECG recording will have disturbances, and a proper baseline is not formed that will make the interpretation of ECG very, very difficult. So patient should not move. Apply gel to attach electrodes snugly. Remove excess hair to enable good attachment of the leads. Only when there is a good attachment of the leads, you can get a proper ECG recording. Let's learn something about the ECG machine and the electrocardiograph, which is a machine used for recording a 12-lead ECG. It consists of electrodes, a central processor, a printer with or without a monitor. There will be 10 electrodes connected as shown below. There are 6 electrodes, bulb-shaped electrodes, which are connected to the chest, and 4 franc-shaped electrodes that are connected to the limbs. So this is the ECG machine. These are the electrodes. This is the monitor, and you can obtain a print from here. As I was telling, these bulb-shaped electrodes or balloon-shaped electrodes have a cup underneath. They are used to connect to the anterior chest wall, also called as the chest leads, and then there are 4 prong-shaped electrodes which are connected to the 4 limbs of the patient. Chest electrodes are interchangeable, whereas limb electrodes are not interchangeable. If you are not keeping properly the leads, then you will get a wrong ECG recording. 12-lead ECG is recorded using these 10 electrodes. There are 6 chest electrodes to record 6 chest and precordial leads. They are labeled as V1, V2, V3, V4, V5 and V6. The electrode connected to the right lower limb is a neutral one. So that doesn't participate in recording any electrical activity. There are 3 unipolar leads and 3 bipolar leads among the limb leads. So coming to the unipolar and bipolar leads, unipolar lead is the one where if it is connected to the body, it will detect the potential difference at the connected point. A bipolar lead is one which detects potential difference between 2 electrodes connected in different areas of the body. Unipolar leads include all the chest leads V1 through V6 and limb leads labeled as AVR, AVL and AVF. That is the lead connected to right arm, left arm and the left foot. There is a small a in front of the lead denotation that denotes augmentation. Because you are connecting the electrodes far away from the heart, the electrical potential at that point will be very, very minimal and it will not be deflected properly on ECG to be recorded. So the machine has a protocol to increase the amplitude of the recorded potential difference and show you. Bipolar leads are the limb leads 1, 2 and 3. So this is the organization how you connect the leads. V1 is placed just on the right side of the sternum in the fourth intercostal space. V2 is placed on the left side of the sternum, fourth intercostal space. V4, the fifth intercostal space in the mid-clavicular line. V3 is placed between V2 and V4. V5 is placed in the anterior axillary line, the fifth intercostal space, and V6 is placed in the mid-axillary line, in the fifth intercostal space. And then you have 4 limb leads, AVR, which is connected on the right arm, AVL, which is connected on the left arm, and AVF, which is connected to the left foot. So basically, you are recording 12 electrodes or 12 leads using 10 electrodes. So one of them is neutral. All chest leads, you record 6 leads. The limb electrodes, one is neutral that doesn't participate. The lead connected, electrode connected to the left foot is neutral that doesn't participate in recording any electrical potential. As a 3 leads, 3 unipolar leads record at given points, and the bipolar leads, lead 1 detects the potential difference between right arm and the left arm in anti-clockwise direction. Lead 2 records the potential difference between a right arm and the left foot, and lead 3 records the potential difference between left foot and the left arm. So what are the indications for an ECG? Before doing any procedure, you should know indications, contraindications, and any complications of the procedure. Basically, ECG is a non-invasive procedure. There won't be any complications, except that you should remember whether the patient is allergic to latex. You will be using the gel, which can be allergic. That is the only contraindication you need to look for an ECG. A baseline and screening test for coronary artery disease and cardiomyopathies, usually as a part of a routine medical checkup. Detection of chamber dimensions, ECG is one of the methods used apart from 2D echocardiography. As part of preoperative evaluation, most of the patients over the 40 years of age, before going for any surgery, they will be evaluated using an ECG to look for any underlying cardiac diseases, suspected metabolic and electrolyte abnormalities. A huge number of electrolyte and metabolic abnormalities that can be detected using an ECG because the electrolytes are involved in action potential of the heart. Evaluation and management of patient with chest pain of cardiac origin is one of the most important indications for obtaining an ECG within 10 minutes of patient presentation to the emergency department. Basically, it can be used for evaluation of arrhythmias. Usually, whenever you suspect arrhythmias, you connect to a cardiac monitor rather than obtaining a 12-lead ECG. But if the patient is stable, you want to completely evaluate the arrhythmia, you can obtain a 12-lead ECG. Diseases of myocardium, pericardium, and congenital heart disease can be detected using an ECG. Evaluation of the patient with palpitations and suspected rhythm disturbances, ECG is the best method useful and also as part of a routine health checkup. So coming to the procedure, before doing any procedure, not only ECG, you have to explain the procedure to the patient and obtain a valid consent from the patient. For ECG, sufficiently expose the patient, maintaining patient privacy, position the patient supine on a couch, wash and dry your hands so that you minimize infections, trim any excessive hair, cleanse the patient's skin with antiseptic solution, apply the electrodes as shown earlier, attach chest leads followed by limb leads, ensure good contact, use sterile gel for maintaining a snug fit to the skin, confirm appropriate placement of the electrodes, feed the patient details, and obtain a recording. Once you obtain the recording, the ECG should be interpreted as early as possible and by a senior physician, and appropriate measures have to be taken if there is any abnormality. Thank you. Stay tuned for further lectures in the ECG lecture series. If you have any doubts, you can post in the inbox. For easy access to these lecture series, you can subscribe the channel, click a like if you like the videos. Thank you. Thank you all.